It's not time to panic, it's time to get prepared.
The CDC is encouraging businesses, schools, and organizations to review emergency preparedness plans. This comes after health leaders describe the spread of the coronavirus, also known as COVID-19, to the U.S. as inevitable, but the risk is low. Right now, there are still only 14 confirmed cases in the U.S. of COVID-19, according to the CDC. There are no cases in Tennessee. Nevertheless, businesses and schools in East Tennessee have been meeting this week to discuss the threat of a possible outbreak. Reporter Amelia Young shares the steps they're taking.
Starting with schools, all should have an emergency preparedness plan in place, but it's been 11 years since most looked at plans for a pandemic. The last one we saw was the swine flu, also known as the H1N1 outbreak. Health officials are not calling COVID-19 a pandemic yet, but Knox and Blount County schools say they have started reviewing those plans, making adjustments. They're doubling down on telling kids to wash their hands, cover their cough, and stay home if sick. Maryville City Schools is doing the same, and as a technology-enabled school district, their plan entails at-home learning for kids if they have to miss school, meaning learning would not go uninterrupted. Every child would have a device, and for those that need internet, the school says that need is already addressed with hotspots they provide. And as for businesses, experts recommend East Tennessee businesses shouldn't be panicking right now, but it's easier to review plans now before the possibility of an outbreak. Here are 3 tips. Review crisis communication plans, how you will communicate with stakeholders internally and externally. Figure out how employees can work from home with access with what they need to get their jobs done. And lastly, check on your business insurance policy. Is there pandemic coverage?
It's easier to be calm, cool, and collected. It's easier to communicate and make plans when it's not an emergency situation.
And again, there are no cases of the virus in Tennessee. The CDC says if you have not traveled to an area with the virus or have been in contact with someone who has tested positive, your risk is currently low. Beth.
All right, Amelia, thank you.